In this video, I'm going to talk about how pausing for presence can make a difference in weight loss surgery recovery. The practice of awareness is the gate to identifying potential relapse and collapse situations. I define relapse as a short-term, usually like 1 or 2 days, lack of awareness of your relationship between food intake and your inner life. A lapse differs from collapse in that one stays unconscious of this relationship for a longer period of time, which results in undesirable habits that are in conflict with your post-surgery weight loss goals. There are many ways to practice awareness. This is an easy and quick method to increase mindful attention and to decrease the likelihood of automatic and therefore unconscious responding. Because eating is a sensory experience, I like to start my patients off with what I call 3x3 sensory awareness. The strategy can be generalized as a practice with food. So 3 times a day, pick 3 senses and state 3 things you notice in that moment about the 3 senses, hence 3x3. See if you feel more connected to what is happening in the now. If the thoughts had a ruminating quality, then check in with yourself to see whatever your mind was worried about or thinking about right before you did this exercise, and see if that rumination has lessened in intensity or perhaps even seems less important. Here's tip 1. For ruminating thoughts, worrying is not the same as planning. For people who prefer or like a writing method of increasing self-awareness, here is a specific plan that you might follow, or in your exercise program, same idea. Start with a piece of paper with a word written on the top, and that word is triggers. Then underneath, write date, time, location, thought, feeling, and the consequences. Ask yourself, what did you stop doing and what did you start doing as a result of that trigger? Then ask yourself, what one thing are you willing to commit to doing to move in the direction of what matters in regards to following your food plan or your exercise program? Commit to this strategy on a daily basis at first. See if you can identify patterns which can then consciously lead to better choice making on your part. For example, perhaps you identify Sunday family dinners as a situational trigger where you stop following your food plan and you start eating the way you did before weight loss surgery. As a result, feelings of self-doubt arise in regards to feeling capable of meeting your goals. You could decide if eating lunch at an earlier or later time might help you eat less for Sunday dinner, which would be a behavioral change, or if being more compassionate, which would be something like working towards emotional changes with yourself when you go off your food plan, would be more helpful to prevent possible shaming. Note, destructive thinking patterns are quite common for people who have undergone weight loss surgery. If you find that you're getting stuck in some of the more challenging feelings such as shame, guilt, and perhaps self-doubt, it might be helpful to reach out to a licensed psychotherapist who can help you become unstuck so that you can continue to move forward in your recovery. Thank you for listening, and I look forward to speaking with you about other tips and strategies that can help you continue your weight loss surgery goals.